is it okay to buy over-the-counter estrogen or progesterone creams and or both and use them on the face as well as on our bodies as a lotion? Will this increase the amount of hormones in our system?
Well, here's what I'm aware of, is there is over-the-counter progesterone in creams. It's been that way for 40 years.
My grandfather used to make them.
And boy, they do a lot of good. I mean, we really encourage women in their 30s, even when their progesterone is starting to decline, to be able to recognize it, and over-the-counter is possible. And I just learned recently that women are able to procure estrogen through one of those big delivery services, a name that I will not mention. And that one concerns me because you're playing with something that can ultimately risk breast glandular cell. So by the time you need estrogen, I say, here's your job. Link up with an excellent, a healthcare professional that you trust, that really knows their stuff about hormones and menopause. Link up with us. Become a member of the Menopause Method. You want a level of excellence there when you're playing with these powerful hormones, and it's not time to mess around. Now, having said that, here's some things we know. That the French used to put estrogen and hormones in their expensive skin creams 50 years ago, because they knew that a woman's skin was excellent when she had sufficient hormones. They didn't mention it. I even heard that some American skin creams were doing that at one time, putting hormones in there. But they're not putting very much in there. And they definitely can affect your hormone levels. And if they don't put very much in these creams, then you're going to be fine. It's not going to be a big deal. Unless you're a woman who's especially vulnerable and especially young, who's already estrogen rich. I sure wouldn't want to see a woman who is estrogen dominant using an estrogen cream when she was 30 years old.
Right.
And how do you know? If you get breast tenderness from your facial creams, you got too much estrogen going on in there. And I would highly recommend that you don't do it if you're able to get these over-the-counter estrogen-containing skin creams. So, yeah, hormones are powerful, and it took me a decade before I started to get really good. It took me hundreds of patients before I started to get really good at getting these hormones right. So to just get them over the counter, progesterone's fine. Now, there's another thing I want to say. Creams. What does that mean? If there's hormones in creams, that means that cream is a strong solvent, because ovarian steroid hormones, that's estrogen, progesterone, testosterone, and DHEA, they're only fat soluble, and they're very poorly soluble. They take strong solvents to get them up into solution for you to prepare a cream. Well, we figured this out 15 years ago. And we said, I don't like the idea of a woman putting strong solvents on her skin, especially in menopause, because I did the math, and women were applying a quart a year of strong solvents containing bioidentical hormones. I said, what's wrong with that picture? So my partners and I, my son and I, we developed an organic oils carrier instead of the strong solvents. In fact, that's how we recommend dispensing these hormones, is in these organic oils. They're certified organic oils. We've patented this. There's 30 pharmacies in the United States that are dispensing hormones in these organic oils, and your compounding pharmacy could do it too. And there's no solvents in there, which means if you look carefully at the bottle and it settles overnight, you're going to see a white layer at the bottom. That's the hormone. It's settled out. So what do you have to do? You have to shake the bottle before usage. It becomes a suspension. It works really, really well. No solvents. So applying hormones in a cream or a gel Yeah, you're also applying what you don't know about that little jar or that little topic lick or whatever the cream comes in or the gel comes in is over 99% of what's in that container is actually carrier. It's actually strong solvent.